Hypertension, it is often called the silent killer. It rarely causes symptoms until it is extremely high or has done damage to other organs in your body. For this very reason, you should have your blood pressure checked regularly by your physician. Well, today, Dr. Tiffany Randolph with Cone Health Heart and Vascular at Drawbridge Parkway is here to help spot the signs before it is too late. So let's get right into it. We hear the terms hypertension and high blood pressure. Are they the same thing?
Great question. They are the same thing. So when we talk about blood pressure, we think about two numbers. The systolic is the top number. That is how much force your vessels feel every time your heart squeezes. And then the bottom number, or the diastolic, is how much pressure is left inside the vessels in between heartbeats. A totally normal blood pressure would be less than 120/80.
120/80. So that is kind of where we need to gauge ourselves. So if they went to the CVS and stuck their arm into the thing, they should be looking for that 120/80. All right, so what is happening in our body when we have high blood pressure?
Unfortunately, many things. So when your blood pressure is high, it puts unnecessary force on all of your organs. So there's increased pressure on your brain, on your heart, on your kidneys, and all your blood vessels. And over time, that can lead to increased risks of heart attacks, strokes, heart failure. It makes you more likely to have end-stage kidney disease where you might need dialysis. It even raises the risk of developing dementia.
Okay, so we called it the silent killer at the beginning, and that is because a lot of people don't even know that they have high blood pressure. At what point should you be tracking your blood pressure?
Oh, great question. So really, by the time you're 18, assuming you don't have any other risks, you should be getting your blood pressure checked at least once every couple of years. So that means if you're not obese, you don't have diabetes, you don't smoke, or any of those types of things, at least every couple of years. If you develop any of those risk factors, or by the time you're 40, you really need to have your blood pressure checked every year. But if you already have high blood pressure, then it might be very helpful to check it even more frequently, especially as you're needing to make any medication changes or things like that. Because we find that actually people's blood pressure sometimes might be higher in the office than it is at home. That's something we call white coat hypertension. And so if your blood pressures aren't as high as at home or in a more restful setting, then we may not need to give you as much medication. We also sometimes find that there might be patterns to your blood pressure. So if you're checking your blood pressures in the morning and the evening, you might see a pattern that would help us to decide what's the best time of day where you should take your blood pressure medications.
Okay, yeah, it can be one of those things. You get nervous when you go to the doctor's office, right? So your blood pressure raises. That's kind of a normal thing. So also had to check it at home. When you check it at home, you should do it in a certain way.
Yes, so it's important, first of all, to make sure that you sit and rest for about 5 minutes. Even small exercise, just walking around your house, things like that, will raise your blood pressure. So you want to sit in a comfortable position with your feet flat on the floor. When you check your blood pressure, you always want to make sure that the cuff is at heart level. So you can sit at your kitchen table, you can sit on the side of your couch and rest it on the arm. If you have your arm up in the air or hanging down, it really will alter your blood pressure.
Okay, good to know. All right, so what are the dangerous complications that could happen if you have high blood pressure, especially for a long time unchecked?
So hypertension, everywhere you have a blood vessel in your body, it can wreak havoc. So it can cause problems with vision, it can cause strokes, dementia, it can cause heart failure, heart attacks. It even can cause peripheral vascular disease, difficulty getting blood flow to your legs, and increase the risk of amputations and other things that, of course, none of us want.
No. Okay. So would someone who maybe isn't checking their blood pressure regularly, would they have any kind of indication that they might have high blood pressure?
So, like you said at the beginning of the segment, unfortunately, it's the silent killer because most people really don't feel anything when their blood pressure is elevated. Some people are more attuned to their bodies, and sometimes once your blood pressures get really high, you might feel symptoms like fatigue, you may have nosebleeds. One really common side effect is headaches or even shortness of breath. But again, many times your blood pressure has been very high for a long time before any of those things might come up.
Right, and you're thinking fatigue and you're thinking headache, you're thinking those are things that I just get because I'm stressed at work, and you might not really be correlating them with your health.
Exactly right.
Okay, all right, we're going to take a quick break, but we're back talking about high blood pressure and hypertension in just a few moments.